Well, good afternoon, everyone, and thank you for joining today. Thank you for joining our special webinar, Securing Healthcare, Be Secure, Not Compliant. My name is Bob Chenette. I'm the Regional Sales Director for JSCM Group. And let me just give you a little background about JSCM Group, and then we'll get into our content. JSCM Group, we are a boutique cybersecurity firm. We only do cyber. And we've been doing this for over 23 years now. And we kind of joke around internally because that's long before it was cyber and a lot longer than before it was cool. And so we're pretty excited about being able to share with you today. And we work with a number of clients across all different industries, and healthcare is one of them. And so today, this is about sharing, this is about awareness, this is about education. And we want you to leave this webinar knowing what you need to do to be secure. And as we said, we believe that if you focus on the security, the compliance will follow. That's what we mean by be secure, not compliant. And hopefully by the end of this time together, you'll get a full picture of that. So before we jump into the agenda, let me just give a little bit of the housekeeping and how we're going to run the format this afternoon. We're going to have, everybody will be on mute and all cameras will be off during the presentation. So it's going to be a little bit of a one-way communication, but rest assured, we want you to participate. We want you to be engaged. And so if you have questions as we are going along, please feel free to put them in the chat. We have our moderator, Felton Martin, who will be able to take those questions and be able to share those with the whole group. So please feel free to use that. And then certainly at the end of the presentation, we'll have an open time for any questions that you may have. So let's go ahead. Let's just jump right into it. And let's talk a little bit about what we're going to do today. So for the agenda, we'll take a moment just to talk about the role that cybersecurity plays in healthcare. It's a big piece now of the healthcare industry, and we want to share a little bit of the background around that. We also want to talk about some of the things that make healthcare unique, some of the challenges that are very specific to your industry. We're going to do a high-level overview of the regulatory landscape. And we're going to look at three key pieces of regulation. I suspect two of them that you're familiar with, and maybe all three. We're going to look at HIPAA. We're also going to take a look at the HITECH Act, that's the Meaningful Use Act, and also the new Health and Human Services Cybersecurity Performance Goals. That's the one that's a little bit newer, and you may not be as familiar with that, but we'll share a little bit so you can see some of the new things that are coming out to support the healthcare industry. And then we're going to share you the best practices. What are the best practices across the industry, and give it to you in a security roadmap so you can see what it looks like and perhaps see where you are on that map. And if you're not on that map, maybe we can help you get started. And then we'll finish up with some time for question and answers. So let's go ahead and jump right into it. And let's look at cybersecurity and the role that it plays. And we're just going to look at three components of cyber in healthcare. The first one is just giving a basic definition of cyber. Then we'll look at why it's so important to protect these digital assets. And then we'll speak a little bit about the growing threat landscape. And for the definition, if you want to keep this really, really basic, this is about protecting your stuff, really specifically your data. That's what this is all about. And a good way to think about this is when we talk about protecting it, we want to make sure that the data that you have is kept confidential. That means that only the people who need to see it can see it. We also want to make sure there's a level of integrity in that data, meaning it's accurate, so that you know whoever is using it across all of your different platforms, that information is accurate, and we want it to be available, meaning you want to be able to get to it when you need it. think of a remote scenario and how much is being done remote these days. You want that data to be available. And to understand the cyber part of it, a good picture of this is to think of a house. So you can have a house and it has windows and doors, and then inside the house there's a vault, and then inside there's a lockbox. And so in that lockbox, you're not putting everything, you're only putting the most valuable things. And so for healthcare, the protected health information, the PHI, that's the stuff that needs to go in the lockbox. And then maybe things like the personal identifiable information, your PII, well, that can go in the vault. And then everything else is in the house. And we have to make sure the doors are locked and the windows are closed and things like that. But that's the role that cyber plays. And the reason that this is so important is around protecting that data. It's about patient trust. That's at the heart of this. You're in possession of some very valuable, sensitive, and personal information, and that is all about the patient trust. And certainly there's an element of complying with regulations and, certainly being able to have continuity around the care that you're providing, but at the heart of it, it's about patient trust. And the reason that this is so vital is because you are under attack. If we look at from 2021 to 2023, healthcare industry experienced over 140% increase in cybercrime. Just your industry. And that's because part of that is the landscape, that threat landscape continues to grow. And we'll talk a little more about what's causing it to grow, but cybersecurity needs to become a part of everything that you're doing and really needs to be prioritized. There are some regular things that can be done, some best practices, but it really needs to be prioritized. And the reason is that just in Q2 of 2023, ransomware rates were up 40% higher than any other quarter in the past 2 years. And again, this is specific to healthcare. So cyber plays a big role because the industry is under attack because of the information that you have. And that really leads into one of the challenges. We're only going to look at three here. There's obviously more, but these are the big three. One, the sensitive data, the patient data that you're dealing with presents a very unique challenge. The number of connected devices that are being used, and then just the diverse ecosystem that you're operating in. And so if you look at just the patient data, this is in the first half of 2022, there were over 20 million healthcare records that were breached. 20 million. And you may be saying, well, why is that? Well, the reason is it's extremely valuable. So to give you perspective on the black market, if someone were to get your credit card information and sell that on the dark web, sell that on the black market, they can get anywhere between $5 to $8 for that. But if they get PHI, it's worth $250. And so that's why it's so important that this data is protected. That's why this needs to be in the lockbox. But this presents a challenge for healthcare because this is what you're dealing with all day long. The number of connected devices, we call this the Internet of Things. And so if you start thinking about all the different things that are connected to the internet, think of the iPads that you may be using, or think of the printers in the office, think of the HVAC system, think of the phones. There's a whole host of things that are connected to the internet that's creating a huge challenge, especially when you start factoring in the high demand for remote care. So on the patient side, looking for more remote solutions, and then just internally in the way that we do business. Even think of people who are now working remote. So all of this is creating a proliferation of connected devices, which is creating a big challenge for healthcare. And finally, your diverse ecosystems. And to just make this, just to break this down and to think of it simply, just think of the hospitals, the clinics, and the labs. Just think of those and how they all interface and communicate and how they're sharing data, some of that same personal sensitive health data across all of those different areas. So these things create a host of challenges for healthcare. And there's another piece. It's not really a challenge. It's actually there to try to help with these challenges, but the regulatory landscape. There's a lot of factors that are in here that healthcare has to be aware of. But think of these regulatory pieces as tools. They were there and designed to help the industry. And we're going to look at three. The first two I mentioned earlier, I think you may be familiar with. HIPAA is the first one. HITECH Act is the second one. Meaningful use is maybe the term that you're most familiar with. And then the newest one is the Cybersecurity Performance Goals that have just been released in January. So what we're going to do is do a high-level overview of these three, drill down a little bit just to show you some of the platforms that they're built on, and then share some of the violations that they have and what are the most common violations that they see in each of these areas. And so if we start with HIPAA, this one came out in 1996, and the real purpose of this is to protect the patient's private medical information. That's what's at the heart of this. That's why it's there. It's really to protect that data. And it was there, it was brought along to give some guidance, to be able to help healthcare organizations to have a framework to try to manage this. And 13 years later, the HITECH Act came along. And this one also, at its heart, is to protect the healthcare records. But this one was a little bit more specific. It was around the electronic health records. And so this one really came alongside HIPAA to take it further and really was built to encourage organizations to move or to transition to electronic health records. And actually from 2011 up until about 2015, there were financial incentives being offered to help organizations move to EHR. But again, the heart of this was to protect the health records, and it comes alongside HIPAA and takes some things even a little bit further than HIPAA did. So these two complement each other. And the third one, the Cybersecurity Performance Goals, these were released in January of this year, and Health and Human Services developed these goals. And this was to be able to provide a tool that can give healthcare agencies and organizations a way to protect the patient, but giving them some guidance, giving them some framework, giving them some tools to help them, because they understand how difficult this is, especially as that threat landscape continues to evolve. And so we'll take a look at each of these a little bit deeper so you can see what's involved with them. And we'll start with HIPAA. And HIPAA is built on 5 different rules. The first one is the security rule. And these are just rules that talk about how do you safeguard and protect the PHI. The next is privacy rule. Privacy rule is limiting who can have access. Think of that confidentiality we talked about earlier. Same concept here, making sure that only the people who need access have access. The breach notification rule, this is making sure that if any individuals are impacted, that they're notified. And they have to be notified within 60 days. The enforcement rule, this defined how are they going to investigate complaints, and then if there are violations, what are they? What are the penalties for those? And so the enforcement rule goes through the guidelines for that. And then finally, the omnibus rule, this one gives patients greater control over their own health records. So they know, so they have control of who can access them and when. So these are the rules, or if you want to call them pillars, these are the pillars for HIPAA. Now, I want you to see the most common violations of HIPAA. And this is not the exhaustive list, but these are the top 7 violations. And some of these things, like failing to use encryption, or insufficient electronic record access control. Like, these are some of the basics of security. So this is why we say if you pursue security, compliance will follow. But look at the first one. Looking at healthcare records without permission or authorization. That's that confidentiality. So that really needs to protect it. And it's interesting that that was the #1 violation, but we want to highlight for you number 2 and number 3. So 2 of the top 3 involve what's called a security risk assessment or a risk analysis. And so the second violation, the second most common violation, was not performing a risk analysis. The second or the third one was you did a risk analysis, but you didn't implement the things that were identified. And we're going to talk more about the risk analysis and why it's such an effective tool. But what I want you to note here, of all the things that can come up as violations in HIPAA, 2 of the top 3 are around the risk assessment analysis. When there is a violation in HIPAA, it is divided into 2 major categories. You can have civil violations or criminal violations. And really what determines that is, was the offender aware that they were committing a violation? Sometimes people may violate one of these and they were not aware. And that would fall into the civil violations. However, if it's determined that the individual knowingly obtained those records or knew exactly what they were doing, that falls into the criminal violations. And you'll notice here that there's these different tiers and what the corresponding penalties would be. These tiers that you see, they were established by the HITECH Act. Meaningful use. I mentioned earlier how HITECH kind of came alongside HIPAA and started to clarify some things. Well, this is one of the areas that the HITECH Act helped to make clearer for HIPAA. And so you can see these penalties. You can go anywhere from $100, up to 1.5 million. There's a big range here of violations, but as you saw from the previous list, these things do happen. And we thought it'd be a little bit of fun for you to see some of the most, we'll call them disastrous cases. And though they may seem extreme, there's things we can learn. There's lessons that we can learn from this. And so this first one, this case, a hacker was able to get the PHI of over 10 million people. 10 million. And what really struck their insurance provider. So this would be, you kind of think of those organizations as they're fully protected, nothing can happen. And that's not true. And you can see here, this was a violation of the security rule. They didn't have some of the basic security measures in place, and they were breached and they were violated. And so the fine itself was almost $7 million, which sounds bad enough. However, The legal settlement was over 84 million. So the key here, the lesson, risk analysis. If they had done a risk analysis, a security assessment, they would have been able to identify where some of the vulnerabilities were, and they did not do that. So that one there, security assessments, would have helped the situation. In our second case, this one, the company exposed the records of over 300,000 people on the internet. Okay, so that obviously is not good, but that wasn't the violation. The violation was a violation of the breach notification rule. They never notified, well, I shouldn't say they never notified them. They did notify them, but in 147 days. They're supposed to do it within 60. And so this one, the fine was $3 million for that. In our final case, this was a city that allowed a terminated employee to access and copy the records, the electronic health records of over 500 people. So this one violated a couple things. First, it was the privacy rule. And then second, the security rule. Again, someone having access who shouldn't have been able to have access after they were terminated. And so, again, this falls into that basic security fundamentals. And if you're doing that, and if you're pursuing the security, the compliance will follow. So let's look at the meaningful use. This is the HITECH Act. And again, remember this one is built, it's built on these 5 pillars, but it's primarily around the protection of the electronic health records. And so that starts with improving the quality, the safety, and the efficiency, and goes all the way through to just ensure adequate privacy and security protection of those records. Again, at the heart of this is the patient and making sure that they're protected and their information is safe. But even in this one, there are violations. And again, we're going to show the top 7 violations here. You see some things that are similar, like look at insufficient access control. Again, that's some basic fundamentals that were not in place, or even encryption practices. Insufficient security measures. This is where pursuing security will lead you to compliance. But look at number 3. Failure to do a risk assessment was the 3rd most common violation. I want to show you the cybersecurity performance goals. Now, we are not going to go through these goals. That's not really the purpose of today. This is just to make you aware that these are there. Describe a little bit about what Health and Human Services is trying to provide, but they really are trying to give organizations, healthcare organizations, a framework that they can use to provide some consistency on how do you do this. And the way that they've broken this out, they've come up with what are considered the essential goals. Like these are the things you have to have. And then there's the enhanced goals. This is what you want to be working towards. There's where you want to be striving towards. And they've broken them down that way. And then all of the necessary resources and related resources and articles are right there with hyperlinks. And so you can click on those and it would take you to the information that you would need to be able to implement any of these. And I wanted to read one quote to you. This was from the Health and Human Services Deputy Secretary. Her name is Andrea Palm. And this is what she said in a statement in January when these were released. She said, "We have a responsibility to help our healthcare system weather cyber attacks, adapt to the evolving threat landscape, and build a more resilient sector. The release of these cybersecurity performance goals is a step forward for the sector as we look to propose new enforceable cybersecurity standards across Health and Human Services policy and programs that are informed by these cybersecurity performance goals. So they're trying to come alongside you. They're trying to come along and give you the tools that you need to make sure that you're secure. One of the things we thought was important to point out here is a little bit around the mindset around essential versus enhanced. And that enhanced mindset is something that comes when you start to take a posture of early adoption. And as you're doing that, and you think about your organization or think about your team, as you start to have an enhanced mindset, there's a few things that start to happen. First is you start to stay ahead of the curve. You're not chasing it anymore. So instead of going and playing catch up on trying to implement what's essential, you're already getting ahead and moving into what's enhanced. Because the way this goes, today's enhanced is tomorrow's essential. And so when you embrace an enhanced mindset, you start to get ahead of that curve. You become an industry leader. Then the competition is the one that's playing catch up. You start to build a culture of operational excellence. And so when you're in this enhanced mode, this enhanced mindset, it minimizes the impact that change has. And think of it this way. If you're just trying to implement the essential things and you took 6 or 7 and you tried to implement those things kind of all at once, think about the change that impacts the organization. It's immense. Where if you have this enhanced mindset, what starts to happen, it takes some time. What starts to happen is the organization and the people, the team, understand that this is what we do. This is how we evolve. This is how we're continuing to grow. And as you're doing that, as that becomes the way that you operate, you're not only building that operational excellence, but you're minimizing the impact that change has on the organization, which leads to profitability. It helps you to be more efficient. It helps you to be more profitable. It future-proofs your business for profit. So embracing an enhanced mindset is something that has a lot of benefits. And that's part of what Health and Human Services is trying to do. They're painting a picture of where you want to go. Now, I want to share with you the best practices from each of the regulatory areas so you can see what they're recommending. This is what they say are the best practices. So what I'm going to do, I'm going to put them all up there so you can see them all. And again, the lists were a little bit longer than this. I just took the top 5 so you get a sense. But you'll see some things on here that show up on multiple lists. So things like employee awareness training. You see that a couple times, or even some things around just making sure you're complying with the regulations. Each one of these have a set of regulations and they're saying, hey, just follow these. But there was one thing that was on all 3, and that is the risk assessment. So that came up as a best practice from all 3 of these, and there's good reason as to why. So we want to share a little bit with you. What are some of those reasons? What are some of the reasons that people don't do an assessment? If it's so great, then how come some people don't do it? And then we'll show you what's behind an assessment so you get a feel for the tool itself. But if I was to open up this call and have you call out or share out the reasons why, my guess is you would come up with most of these. They are extremely effective at identifying where the weaknesses are. And they identify where the vulnerabilities are. And if you're trying to get to a place where you're more protected, you need to know where the vulnerabilities are, and an assessment will do that. They are fantastic at protecting the patient privacy. That's at the heart of these. Remember, it's about being secure, not compliant. So making sure that this information is kept safe, kept in the lockbox is what's key. It helps people to stay compliant. Quite frankly, just by doing this, you're able to address a lot of the issues that are in the regulatory requirements. Risk management. In other words, it minimizes your risk, especially as you're demonstrating that you're taking reasonable actions. You're taking reasonable steps. That's what these organizations are looking for. They're looking, are you doing the things that are within your control? And are you taking those steps? And doing an assessment demonstrates that, so it minimizes your risk and it prevents breaches, flat out. So it's a very, very effective tool, and that's why it's so highly recommended by each of the groups. So the question is, well, then how come people don't do it? What are the reasons that people are not doing a security risk assessment? And again, if I opened this up, I bet you could tell me. You could probably get most of these. But the number one is budget constraints. And I saw a meme recently, it was just last week. It was like a glass jar. And in the bottom of the jar were, a bunch of coins just covering the bottom of the jar. And underneath that, it said cybersecurity budget. And then the jar next to it was, filled to the top and kind of overflowing with coins. And underneath that said cybersecurity budget after a breach. So in other words, you need to be investing in this to prevent it. It's amazing how they will find the resources and find the money after something happens. The idea here is to be proactive and to get ahead of it. There's a lack of awareness. It could simply be that organizations didn't realize that this was such a valuable tool. Perhaps they didn't understand what an assessment was for, and maybe they really didn't realize that it was something that was necessary to do. So it could simply be this, they're not aware of what the value is of the security risk assessment. Resource constraint. What that means is many of the teams, your team perhaps, I know the teams that we deal with, are small IT teams. They don't necessarily have, a cybersecurity department. It's the IT team that's trying to do all this. And so they feel like there's no way they could do this on their own. And they probably couldn't do it on their own. It's why you would use third parties to help you with this. But they look at it and go, there's no way we could do something like this. Another one, and one that we see a lot, is there's an overconfidence in the current security measures. In other words, the IT team's looking at it and saying, no, we're good. We're okay. We're safe. Not necessary. We're fine. And so that overconfidence, sometimes you don't see the vulnerabilities, you're not aware of them, or there could be blind spots. And then another one is just the fear of discovering the weaknesses. That after an assessment, it's going to show you these vulnerabilities. Well, sometimes teams are worried about that. That's not what this is about. This isn't a sales tool. It's not about identifying all the things somebody did wrong. This is a way to help you get better. We just did a security assessment review where we shared the results. It was last week. And it was with the client, the IT department, along with the CFO of the company. And after we shared all the results, and they had a lot of vulnerabilities. There were many. He said afterwards, this is great. This is just what we need. We need to know where those things are so we can get better. And he even went on to say that he didn't view it as a reflection of the IT department. And it's not. That's not what it's intended to do, but it is intended to identify the weaknesses and vulnerabilities and help develop a plan on how to remediate them. So let me just show you a little bit about security risk assessment. And I'm going to speak to ours because that's the one that I know the best. And when we're doing our assessment, it's built on 4 different pillars. And when we're doing this, this is not done by a computer. This is done by a person. Matter of fact, these people are very highly trained ethical hackers. I got a chance about a month ago to go visit with them and watch them do what they do. Unbelievable on what they can do. But to show you how they're doing it, the first thing that they're doing is a penetration test. They're checking the exterior of the environment. So think of our house. This would be like walking around the house, making sure the doors are locked, the windows are locked, the sliding glass door is not open. Like that's the external, but that's not enough. Same with a security assessment. The idea is, well, what happens if somebody did get in? How far could they go? And that's the internal test. So if I got into the house, could I get into the vault? Could I get into the lockbox? How far could I go? Our security assessment is going to do the same thing. It's going to test the exterior, but then we're going to go internal and be able to see how far can we get within your network. We do spear phishing testing as a part of that. And the reason for that is vast majority of breaches start with a person, someone clicking on something, that perhaps they shouldn't be, or some type of social engineering where they're getting a message or an email from someone, they think it's the real person and it's not. And so we include that type of testing so you have a clear picture of your own team and your own organization where you are when it comes to that. And it may be you're doing very, very well in this area, but it also may be that it is opportunity for awareness training. And the final piece, and one of my favorites, this is a business process review. And this is where we sit and talk to all departments and the department heads and talk to them about the policies that are in place. It's not just about the IT department. So if it's human resources and someone leaves the organization, what are the steps and procedures to ensure that that person still doesn't have access after they leave? So all of this is part of our risk assessment. And what this does, this creates a plan. It's not just a report. It's a plan to help get you on the path to remediate these things and gives you some clear guidance on how to do it. Now, this list, I'm not going to go through this entire list, but what I thought would be helpful for you is we get asked, well, what do I need to do to be secure? What are the things I need to do? These things, we have 11 of them. When we're dealing with clients, and remember, we're only doing cybersecurity, so this is across all of our clients. These are the top things that you need to do to be able to be secure. So your password hygiene and multi-factor authentication and segmenting the network, encryption. These are all different things. When we do an assessment, all of these things are covered within that assessment. So if there's areas here where you may not be doing them, we will be able to find them and also give you the remediation steps to take care of it. What may be more useful for you is a roadmap. And so what we're doing is just in big buckets here, putting a roadmap together of where do I start? What do I do? Like, how do I do this? And when you look at this map, you may be at different points along the way here, but it all starts with the planning and the assessment. And so we've already talked about the comprehensive risk assessment. If you haven't done one, that is a best practice. That is a great place to start because that will help you define your cybersecurity objectives. Because in that report, it will show you the things that are most critical. And again, we did one of these, I did two of these last week, and the one client had a lot of critical items. There were quite a few. However, most of them were things they were able to remediate on their own. And we give them the remediation steps of what to do and how to do it. But it was great for them because they left with a plan. They left with a map. They left with some clear objectives of what they need to do. After you've done that, then you start getting into the policy and planning. And this is where you're developing your security policies, incident response planning, even your own training, your awareness training for your employees. Incident response plan means, do you know what to do if the systems go down? If you were under attack and a system had to go down, or multiple systems, does everybody in your organization know what to do? How would you do payroll? How would you process an order? How would you send information? Like, start thinking about what you do on a daily basis. An incident response plan helps you to think through those things ahead of time. Then there's the implementation, and these are all we'll just call these kind of those basic security fundamentals of the access control, making sure that only the people who need access have access, and making sure that the data is protected, and that there's security measures, the basic security measures. Again, this is that pursue security and compliance will follow. And then you monitor, and you have your response, and the best practice is to do the security audits on a regular basis. Annually is the best practice. And maybe not everybody does them annually, but you want to get on a regular cadence of those. And then you want to build a way to have a feedback loop so that you're learning lessons, that you're updating those policies, that you're collaborating and sharing information. A good example is next week I'm going to be in Orlando for the HIMSS conference, which is a healthcare specific conference. And at that conference, there's an entire section, huge section for cybersecurity. And that's all it is in that particular area. And so that would be a way for you to come and talk to people in cyber, but also talk to your peers, talk to other healthcare providers and learn from them and what are they doing and sharing best practices. And so this map gives you a general overview of what you need to do to get yourself on a road to success. If you need help with this, if you have questions about this, if you'd like more information, by all means, just let us know. We certainly can help you with this. This is what we do, and we love being a thought partner for you as you're trying to figure all this out. So we wanted to boil this down, that if you were going to leave with, okay, what do I need to do? Like, where do I start? There were a couple things. The first one, a risk assessment. That one's coming through loud and clear, and is coming through all the regulatory areas, all the best practices. This is something that you need to do. If you're already doing them, fantastic. Continue to do them. If not, that's something you should be pursuing. Password hygiene. So what this means is, how are you managing your passwords? How often are they being changed? How often are they being forced to rotate passwords? How long is your password? And just to give you a little fun fact here, if your current password, let's say your organization's doing 8 characters, and that it's a combination of numbers and upper and lowercase letters and symbols, if that's what you're doing today, a hacker can crack that in 39 minutes. It's crazy. It's crazy, and it continues to evolve. Now, it's not reasonable for people to have 18-character password. We understand. But are you using multi-factor authentication? If you're not, start. There is no reason not to. That will dramatically improve the passwords. Employee training, awareness training is another thing that has a big impact, especially we saw over 70% of the incidents come from the employees. And so you start doing some of that, that will have a big impact. And then the last one we heard earlier, just comply with the regulations that are already there. Right? Those regulations are there to help you. They're not there to slap you on the wrist. They're there to give you some guidance and point you in the right direction. So I want to thank you for listening. I hope that information was helpful for you. Certainly, if you would like any additional information, my contact information is there. We're more than happy to answer any questions and provide any other information we can. But we have a few minutes left, so let me just go ahead and open it up for any questions. Felton, do we have any questions out there?
What types of devices can be tested during a security assessment?
Ah, very good question. We're doing all of the devices that are connected to the internet. So it could be the endpoints, think of a laptop, it could be a desktop, it could be printers. When I went to visit our ethical hackers, the night before we had dinner, I was asking, what do they see? What's the most common thing they see? And they told me that it's a printer. And it's a printer where they're able to get the password and from that go into the rest of the network. And the following morning, one of our hackers came over and grabbed me and said, hey, come look at this. And he showed me. He was in the printer. He pulled up the domain password, was able to release it so he could see the characters, got the password to the entire domain and went into the entire system off the printer. So the point of that is we're looking at all of those various endpoints and access points in the entire network.
Second question, will there be any downtime for my company while testing is being done?
Very good. Actually, no, there isn't downtime. Um, um, we're divided into a couple different teams. We have a blue team, we have a red team, we have a purple team. Well, the red team is the team that does the security assessments. And so they will be partnering closely with the organization, preparing everything, letting them know when they're going to be testing and, very transparent in when we're doing all of the testing, but it does not have any downtime for the organization. All right, well, thank you, Felton. Well, thank you again, everyone. If you are in Orlando next week and you happen to be at the HIMSS conference, please stop by and see us. We will be at booth 1114. We would love to say hi in person. And we just want to thank you for taking the time today. We hope that you found this helpful. And certainly if you need any other information, you just let us know. But I would like to wish all of you a great day.